sometimes plants show subtle signs before a bigger problem develops. One possible factor behind this condition is Cordana musae. Some of the signs you might notice are yellow or light brown oval or eye-shaped spots appear near the edges of lower leaves. Over time, these spots spread and the tissue in their centre dies, gradually forming a distinct concentric area. These spots may lengthen along the veins as the leaf grows. Some spots may merge to form larger patches of dead tissue surrounded by yellow tissue. When the leaf edges are infected, small concentric spots develop. Then the dead tissue forms long, light brown stripes. These stripes sometimes extend to the midrib. Diseased leaves can be quite noticeable because the infected areas are often surrounded by a bright yellow halo. This issue may develop due to factors like these symptoms are caused by the fungus Cordana musae. Also known as Cordana leaf spot, this disease is one of the most important fungal diseases affecting bananas, prevalent in most banana growing regions. The pathogen spreads through spray and wind, causing it to spread to nearby fields. Fungal growth is vigorous in hot, humid conditions with frequent rainfall. Leaf damage caused by this disease significantly reduces photosynthetic area and crop yield. You can start with gentle or natural methods such as there is no single biological solution to combat this disease. Therefore, proper management of the banana plantation is crucial. In severe cases, spraying with organocopper preparations such as 1% Bordeaux mixture can be applied to infected areas. If needed, stronger treatments may include, if possible, always consider a combination of preventative and biological treatments. Because there are several different leaf spot diseases in bananas, it's crucial to ensure you're dealing with Cordana leaf spot and not freckles or sigatoka leaf spot. In severe cases, use 0.4% mancozeb or oil-based preparations containing 0.2 to 0.4% copper oxychloride. Fungicides such as chlorothalonil or mancozeb and root fungicides such as tebuconazole or propiconazole should also be used. Ensure the fungicide reaches the leaves up to the top of the plant. To help reduce the chances of recurrence, use disease-resistant varieties if available in your area. Some are commercially available. Maintain adequate spacing between plants to avoid shading and leaf contact. Ensure new plantings are separated from infected areas. Avoid sprinkler irrigation to minimize relative humidity and instead use drip irrigation. Apply a balanced fertilization regime, especially avoiding excessive nitrogen fertilization. Remove infected leaves and burn them. Practice field hygiene by removing dry leaves from the plants. In general, oval-shaped yellow or light brown spots appear near the edges of the lower leaves. Dead tissue forms long, light brown streaks. Infected areas have a yellow halo. Follow for more helpful plant care insights.